Well, let's change tack now, but also coming out of this BRICS summit is the health challenges facing many African countries, and it's been well documented. There's now talk of a new vaccine center that's going to be opened here in South Africa. Angelo Coppola, our CGTN correspondent, has this report.
Perhaps one of the biggest public health interventions that can solve many of the challenges continentally and within the BRICS countries are vaccines. They have saved hundreds of millions of lives globally.
There really is a growing interest across all five countries in vaccine development, both from the basic science, developing new, cleverer vaccines, new vaccines for new emerging diseases, but also trying to get more manufacturing out there for more generic vaccines so that we can have a more reliable supply and potentially a more cheaper, more competitive supply of vaccines for the marketplace. I think all five countries have got both the science and the manufacturing emerging capacities. Some are much more advanced than others, such as India and China. But I think it's something, a really shared interest, which if we put everyone in a room, I think we'd find real commonalities.
Africa has seen its fair share of diseases which could have been prevented or managed differently.
The African continent still has one of the biggest challenges worldwide in terms of what we call vaccine-preventable diseases. We saw this recently with the Ebola outbreak, where we didn't have a vaccine and we desperately needed a vaccine. And amongst African scientists, there was actually a call to say, we should have been able to step up to the plate. We want to be able to solve these problems ourselves and in our own settings.
Several of the continent's health ministers and finance ministers got together some time ago and signed the Addis Ababa Declaration,
which actually said, amongst other things, that we need to prioritize vaccine-preventable diseases and new vaccines, but also saying that they wanted to prioritize manufacturing of vaccines more strongly in African countries so that you have more of both a domestic and a regional supply of vaccines. So there's a real interest in this.
There's a very specific need to find African solutions given the constraints faced in many African countries.
As technology emerges, we want better vaccines, simpler vaccines, vaccines that you don't need refrigerators and cold chains to get out to the periphery. So there are many research challenges and there are many diseases that we still have to tackle in this region.
On a BRICS level, there's also a keen interest in finding solutions.
We've already, from South Africa, had some dialogue with China, for example, and with India. But I think there are real opportunities to look at scientists across the countries to say, are there common diseases such as influenza? Are there things that are going to be common to all of us that we could actually try and pool our expertise? That, I think, would be a benefit.
Cooperation between the BRICS health ministers to find mutually beneficial homegrown solutions using the combined expertise of all five countries appears to be a foregone conclusion. Everyone understands the challenges and the need to pool resources. I'm Angelo, Coppola for CGTN in Johannesburg, South Africa.